We're going to do a bit of IV cannulation today. I've got a bit of a practice arm here, which isn't ideal, but we'll see how we go. Okay, so the first thing that we're going to do is we're going to explain the procedure to the patient, make sure the patient's comfortable. We're going to tell them we're going to put a needle in the back of the arm in order to give them some drugs, in which case we might give some morphine or some fentanyl for some pain relief. So make sure the patient's comfortable with that. Next step is to prepare our gear. So I've got a tray prepared here. So I have a tourniquet which I'll apply onto the patient's arm. I have a selection of Gelcos, so generally speaking we have a 20 gauge and we have an 18 gauge. Main preference, if the vein's big enough, is to use an 18 gauge. You just got more options with that one. If blood products or other mainly blood products are given, the minimum gauge that you need is an 18 gauge. We have a syringe here, a 10mm syringe and some normal saline. So I've already drawn the normal saline up. We use that as a flush. So we check that it's the right substance, so 0.9% sodium chloride, 10mm, we check that it's in date, and that we check that with somebody to make sure that's correct. So that's all ready to go. And we remove the air from the syringe. And we have our swabs, alcohol swabs. We have our opsite, and we have a bung. So we can just use a bung that has a single port. The other alternative is a three-way tap, so that just gives you a couple more options with the three-way tap than with the bung, but either one will do. I've prepared a couple of strips of tape as well to tie down the cannula, and so the IV tray is ready. We have everything set up. It's great to have an extra pair of hands though that can help you with that, rather than doing it on your own. The next thing is to make sure that you've got your own personal protection. So some gloves in case there's some blood being spilt, preferably some eyewear as well in case there's a spurt of blood. And generally what I also like to do is I like to put something on the patient so that the blood is not going to go down onto their clothing. Okay, so we're all set to go. We've explained the procedure, the patient's comfortable. We apply a tourniquet on the upper arm, on a single boned limb, around the humerus preferably, give good circumferential pressure. Okay, and we're going to try to raise the vein. What we're going to do is ask the patient to clench their fist, open and close their fist to pump the blood around. So we're not totally occluding the blood, so we're just blocking it a little bit. So the arterial blood is still getting in there. We're blocking the venous blood from returning. What you can also do is use gravity, so put the arm down so that the blood flow down. Gravity is another good aid. And the other thing that I like to use is a bit difficult with this hand, but I use this technique where I have total control of the hand, and also I can use my thumb then to apply pressure or a bit of tension on the surface, so I can hold the vein steady. So when I'm cannulating, if it's a large vein, it's not wobbling all over the place. So I've got good control and a bit of pressure on there. So we've identified a vein we're going to use, so that looks like a nice good one. There's another good one over here. Another little technique we can use to highlight a vein is to use shadowing. So you can use a pinch torch or the light, and you can see the shadow playing on the edge of the vein. It's just another good little tip. Okay, so we're ready to cannulate. Okay, what we need to do is we need to swab the area. What I like to do is, some medics I see quite often just dab the area. I like to do a really good thorough swabbing, because you're going to cover that with your opsite, and you want to make sure the opsite is all over the swabbed area. So make sure that you've got a good swab and remove any dirt that might be present. Okay, now we're ready to cannulate. We have our opsite ready, and we have our bung open ready, and keep that in the packaging until it's needed. And we're going to select our Gelco. Okay, open our Gelco. Okay, make sure the end's in tight. Okay, take the Gelco out. Okay, now next thing we've got to make sure is that we got to be aware of needle stick injuries, so we make sure that everyone is aware, if there's anyone else around, that the Gelco is out, that there's going to be a sharp out. So we just make everybody aware that the cannula are going to be taken out, so they're aware of that. Make eye contact. Okay, we remove the Gelco from its protective covering. Okay, and we're prepared for a cannulation. Okay, so again, we've identified the vein, and we now, some people go in high. I don't like that because there's a risk of going through the vein. So I tend to come in fairly shallow, and I tend to come in from the side, the bevel upwards, so that you can just pick up the vein. So I tend to just pick up the vein, come in from the side, insert, and then just go straight in like that. That's it. Now, if it's correctly in the vein, you should see some blood flowing up there, so it's called a bit of a flashback. Insert the vein a little bit further. Be careful not to go too far with the needle, and then what you do is you then just feed the cannula up nicely up the vein like that. Okay, put your finger on or your thumb on the end of the cannula up here to stop blood from flowing out when you take the needle out. Release the tourniquet. Okay, now the next most important thing is you're going to say sharps out. So again, you look around. It's a bit like defibrillation. Prior to defibrillating, you make sure that everyone's aware that the sharp's going to be out. In this case, this is a non-retractive, non-protective Gelco. So you look around, make sure it's sharp's out, everyone's aware the sharp's out, you have your sharps container ready, and you can remove, you're safe now to remove the Gelco, okay, and dispose of it in the sharps container. Okay. Now the only thing stopping the blood from flowing out now is your thumb. So now we get our bung, and again, it's good if somebody could hand that to you, okay. And we just need to remove the protective cap, okay. We screw the bung on. Okay, at this point you can release your thumb and make sure that is secure. Okay, so that's fairly secure. What I like to do now is re-swab the area. Again, you might have had a few drops of blood on the patient's hand. So now again, particularly underneath and around the Gelco, I like to re-swab that. Just want to make sure that's as sterile as possible. Okay, that's fairly safe to do that. Now the thing's not secured, so we've got to be careful that we don't pull that out, but we just want to make sure that that's in properly before we tape it down. Again, we get our normal saline, check that with the normal saline, we've got no other syringes or anything else there. All right, so we take that off the ampoule, make sure there's no air in there, okay. And again, we can use a swab. What I like to do also is just to swab the end. Okay. Insert your syringe in the little bung there and twist it on, okay, and then administer your saline. That's it. It's all flowing nicely, and what you're looking for is make sure that there's no extravasation there, there's no tissuing, that it's all going nicely in the vessel. This is moving very, very nicely now, okay. So we're satisfied that that's in. We can take that back out again, reconnect that back to our normal saline in case we wish to use it again. Okay, and the next step now is securing the cannula. So we can use this offsite that we have here. We take off the protective covering, okay, and we'll see which is the, there's a, just need to remove this paper flap. That way. That sits just at the junction of the cannula, like that. The other two bits just go from underneath, like that. Okay, and we make sure that's down nicely. Then we can remove the paper surrounds. Okay, so our offsite is nicely surrounding the cannula, and then what I like to do is to apply a chevron, so typically go underneath the cannula like this. ensure that it won't get pulled out, and then I'll put one across the top. Like this. So again, it's very, very difficult now to pull out. Okay. You can also use the opside also comes with a couple of other bits of tape, but they're not very long, so you can use those if you wish, but that's what they're there for. But anyway, a couple of bits of tape like that is quite sufficient. So now that cannula is secure, we've flushed it, we've made sure that it's patent, and now we can use that to administer any drugs that we wish to. Okay.